today is Wednesday, September 2nd. So welcome to the new program year, FY20. So today we are here to discuss PIMS, the data collection tool, the newly updated data collection tool, as well as a bunch of updates from Tori and the federal office. So as you join the room, please do take a moment to complete the pre-polling questions. We want to make sure our webinars and educational offerings are beneficial and helpful for you guys. Take a moment to do that, and as you do that, I'll just reset some of the objectives for the day, and just introduce you guys who are new and who might not be familiar with PIMS, which is the Performance Improvement Measurement System that was developed, I don't know how long ago it was, probably 6-7 years ago now, as a way to track both planning and results of flex-funded performance improvement projects. So the tool that we're referencing is organized by activity categories and aligns with questions asked in the PIMS report that you guys will submit. And we have recorded webinars previously. This will be our new recorded webinar to help educate new people as they enter the Flex program. So as the webinar goes, please do take a moment to type questions into the chat box. Tori will have some suggestions and tips, and we'll have plenty of time for questions, both chat questions as well as discussion questions as we go. Tori will give a bunch of updates and information about PIMS and the data collection tool, and then I will do a brief overview of the tool, both updates to it as well as letting you guys who have not had the opportunity to spend any time with it, just really exactly what it is and what it looks like. The webinar is scheduled for an hour and a half, and that should be more than enough time, but I do encourage you to type questions into the chat box. I'll be keeping track of those as we go, and then we will have time to open it up for questions. If nothing else, I will let Tori get started.
Thanks so much, Caleb. All right, everyone, thank you for joining me today on this PIMS webinar. We're going to be going over quite a bit of information, so please type your questions into the chat box, and Caleb will help me facilitate those at the end of my remarks. And then Christy Martinson is also online and may be responding to some of those easy answer questions as well. All right, so we're going to go ahead and get started. Our agenda for this afternoon is to go over what is PIMS, the Performance Improvement Measurement System. I'm going to chat a little bit about the FY18 PIMS results, and then we're going to do kind of a look back for the 4 years of the last project period cycle of the Flex program. Then we're going to talk about updates to the FY19 PIMS data collection. I'll go over some very important reminders, and in that as well, I will also chat about the end of year report that we will be releasing very soon to your EHB tasks. And then I'm going to turn it over to Caleb to talk about the resources from TASC. So what is PIMS? PIMS is the Performance Improvement Measurement System, and it's an online data collection system used by many FORHP programs and across HRSA to collect data about our awarded funds. Each program is customized and it looks different for every single program. So if you are involved in the SOAR PIMS data collection or something involving with our coworkers in BIPIC or BHW, PIMS will look very different for each of those programs. So for today, we're talking about PIMS for the FY 2019 data collection period, which was September 1st, 2019 through August 31st, 2020. So it ended on Monday. The PIMS reports are required and they have a specific term in the notice of award. So why do we collect PIMS? It allows FORHP to identify future baselines and track trends for improvement, and it helps us also identify best practices. It informs tasks in Arquita on tool and resource development and strategies for MBQuip and other parts of Flex. And it provides contacts for FMT as they also do an analysis of your PIMS updates. And most importantly for FORHP, it informs HHS leaders in Congress of the impact that the Flex program is having and the opportunities that exist for improvement. So now a little bit of a look back into the FY 2018 PIMS results and looking into 4-year trends. So this is the number of states working in each Flex program area. Of course, we're going to see 45 in the quality and the financial operational sections, since those are both required sections. For population health is our third highest participation, and then participating in CAW conversions and innovative models. And you'll see a big difference here. In the previous cycle, we had population health and EMS together, and now they're broken out into 2 separate program areas. So overall, this is the number of critical access hospitals participating in each Flex program area. You can see that we've had an increase in the number of CAW participation, and we're very excited to see that continue to rise as we move through future program years. Overall, with the requirement of MBQuip, we've seen a huge increase in the rate of improvement. This is the measure that is reflected for the core MBQuip. And this is actually what we report up to HHS in Congress. So it's an extremely important measure, both for the SOAR program and the FLEX program, but also to FORHP in general. So for our additional quality improvement measures, we've learned through the MBQuip refresh discussions that more hospitals are participating in the additional quality measures, and even outside of that as well. We are very pleased to see the increase in CAW participation in the optional quality measure reports, and we know that there are many factors that influence individual CAW outcomes in this roll-up at the national level. Beyond the numbers, we're interested in exploring more about what works and what doesn't for these additional quality measures. And I know my MBQuip coordinator, Natalia Vargas, is very interested in your feedback and thoughts on this in particular. For a little bit of the financial and operational, for the in-depth financial assessments, we're seeing a greater uptick in CAWs taking advantage of these assessments throughout the years. You can see the pretty big jump that happened from FY17 to FY18. For the community health needs assessments, as we continue to grow into more of the population health efforts, we see an increase in the CAW participation in the population health efforts. It's more of an opportunity to dive in and learn about the specific projects that are helpful to your critical access hospitals in the area of population health. The last one I'm going to chat about is the number of EMS entities participating in the FLEX program. So we broke this down into the EMS time critical diagnosis and the EMS capacity and operations. You can see that we have a huge uptick here in the FY18 PIMS collection for time critical diagnosis. And as a reminder, this PIMS report did not collect in any of the supplement work that you all did last year. So this is just strictly using FLEX funds. Now I'm going to chat a little bit, actually quite a lot of it, about the PIMS data collection for 2019. So how do you find PIMS? You're going to access it through the electronic handbook system, EHB. There's a helpful video attached here on how to access your performance reports. They are currently open right now for you to start going in and inputting data, and it's open through October 30th, which is when it's due to HRSA. You can see the screenshot here that if you go to grants and under submissions, you can go on work on performance report to access the report. Attached for the resources for today's webinar is going to be the PIMS instructions and data dictionary for the FY19 FLEX program PIMS collection period. This document is going to walk you through exactly what you should be reporting and what measures are included in there. It also has a list of frequently asked questions compiled from the last few years of PIMS reporting. So what is going to look different this year? So because we moved from the grants, the old H54 FLEX program, to the brand new cooperative agreements in the U2W, we did shift a little bit what the work plan activities look like. So therefore, we matched all of the old work plan activities to the new work plan activities, and you're going to see a couple big changes in PIMS. So instead of having 7 forms where we had the population health and EMS together, you're going to see 8 because those are separated out. So this is a direct screenshot from what you should see in the navigation panel of your PIMS report. We're also going to ask you to report on any H54 no-cost extension funds and activities. So I understand that it's not going to perfectly align, especially if you have activities that were happening and carried over from population health and EMS, but please fit them in as you see appropriate. If you have any questions, please reach out to myself or your project officer for how to align these program areas. But because the H54s are kind of an in-between year, we still want to be able to capture that data. So we're going to use the H54 no-cost extension as carryover money. So the PIMS reporting process. The first step, of course, is to log on to EHB and go to your performance reports to open PIMS. Then you're going to select the applicable activities in your state flex program. So whatever is written in your work plan for FY19, inclusive of the H54 activities, you're going to need to select those items on the selection page. This will unlock each form for you to fill out. You're going to record individual co-participation and improvement in each of the selected category areas. You'll also record your spending in each activity category. You're going to save each page and mark it as complete and validate and submit your data. We then, as project officers, are going to review your PIMS report and ask for any clarifications that are required. PIMS support, so it's a little blurry here, but up on the right-hand side, you're going to see this nice little support tab, and underneath it's going to say FORHP instructions. And this will also lead you to how to submit your PIMS report, and it's available to you right in EHB. What we've also done for you this year is to link to your H54 Old Flex grant. So on your PIMS reporting page under resources, you're going to see your old grant right here, H54, and this will take you to your old grant folder, even if it's inactive at this point. It will still link your existing U2W to your H54. So you don't need to go back and search in EHB, you already have that linkage right available. PIMS Navigation. So your first page that you're going to see on the PIMS report is the selection page. This is going to open up to show all of the possible activities that you could report on, and then it will link to an individual form where you're going to input data. So the first thing that you should do when you get into the PIMS report is to check your critical access hospital list. So if you open up and go right to the MB Quick core measures, you should see a list of all the critical access hospitals in your state. If there is any issues, please reach out to your project officer immediately, and we can go in real time and add or delete or edit a critical access hospital name. Then you're going to select your activity categories. So this is a screenshot from the Flex selection page. It has every single activity listed, and you're going to just check the box to select that activity that you did in your FY 2019 work plan. You're then going to enter that COD data. So you can see here that you have 2 options. You have participation and improvement. And I'm going to go over those definitions in a little bit. But it will automatically start tallying the number of hospitals that you select at the bottom here. Now we also have this line for historical participation. This year it will not be checked if you previously reported a CAW participating in any previous flex activity, because this is a brand new project cycle. So in future years, if you selected that they participated in quality improvement, it would show up for future PIMS as historical participation. This year, this should all be blank. There are a few sections with a bit different data entries. The first one is item 2.1, where it doesn't have any cost election. You're just going to record the amount of spending that you did in that program area. The same thing happens for 4.1. Items 4.2, 4.3, and 4.4 are all the same, where you're entering the number of EMS entities participating in those activity categories. Item 5.1 and 5.2, you're only recording critical access hospital participation, and you're also going to be recording the number of reports or documents you created. In item 6.1, this one is a little bit different, where you're reporting the number of hospitals requesting assistance in converting to critical access hospital status, the number of hospitals successfully converting to critical access hospital status, the number of hospitals requesting assistance but then did not convert, and the listing of hospitals that did not convert. And for 6.2, you're only recording the critical access hospital participation. So the next section is going to be the flex spending page. So this is where you're going to put in the total award for the current report period. So that's what you received for the FY 2019 notice of award. The total approved carryover report, and that's going to be anything that you have in H54 no cost extensions. So anything that you were granted from the old flex award that you were allowed to continue to spend down in this past year, please input that number here. And then you're going to have the unspent funds award. So what you estimate that you did not spend in your first year of your flex program. So the total award is going to add to the carryover and subtract from the unspent funds, and you're going to get this actual spending amount. You're then going to be able to add in all of the spending numbers for each of the individual activities that you worked in for this program year. At the end, all of those activity categories are going to add up, and that's going to be the actual program spend, and it should equal the total flex awards utilized that you reported in the first section, or you're going to receive an error. So make sure that those numbers are in alignment. Again, we are cognizant that this can be a little tricky, especially when we're including the H54 award. So please use your best judgment. You can estimate. It doesn't need to be an exact number. We completely understand. I did include in the Flex program instructions the FY 2019 awards that were posted on the notices of award. So those are in Appendix C of the PIMS instructions. A few reminders as you go through the PIMS process. Please mark each page as complete, except for the selection page, which does not have that section on it. You need to specifically say, yes, this program area is complete. And then save is also a very critical piece here as well. If there's any discrepancies that you think your project officer is going to see when reviewing this report, you can add it here as a comment, and we'll be able to see that as we go through our review process. So you'll know when each page is complete when you have this nice little green check mark right next to it on the grantee data entry page, which will be on the left-hand side as you move through the PIMS forms. As a reminder, you are going to be able to see your old PIMS submissions right on the left-hand side of the screen under reports. You're going to see a section with PDFs, and those are going to include all the PDFs from your old submissions. And then this submission will also show up as a PDF once it is complete. EHB Help is going to be your friend during this process. If you are receiving any error messages, if you are having a difficult time inputting data, if the system is just not letting you in, I encourage you to please reach out to the EHB Help Desk. This is the phone number, and then this is the web form that you can go in to submit a ticket. Once you receive a ticket number, please let me know immediately. That's my email right there. I'm going to be tracking any issues that you have as we're moving through this together. So please let me know immediately if you're having any trouble. So now I want to chat a little bit about the end of year report, which will be coming out very soon to you. It's going to be due on November 30th for the FY 2019 program. I'm going to ask you to please submit one significant accomplishment per program area in which you worked and a completed work plan for all activities for FY 2019. So what we're imagining is having a brief summary for each of the program areas in which you work, to outline the significant accomplishment, to describe what activity you were doing and how the activity was implemented, to go over the impact of that specific activity, any lessons learned and best practices that you're willing to share, and importantly, the recommendation, if you recommend this activity for other Flex programs, and to discuss why or why not. This guidance will be out very soon and available on the TASC website. It will be a submission in the EHB system as well. Just a reminder on who your project officer is. We recently restructured in order to better manage the whole country. So we're each handling a region of the country, with Regency getting the benefit of the whole team. This is your project officer assignment. We also have a link to the project officer map, which is live, where you can go in and click on your state and you can see who your project officer is for Flex, SHIP, and SOAR. And here is our contact information. I welcome all of your questions.
Awesome, thanks, Tori. So we've been getting questions in the chat box, so thank you very much for that, and thank you, Christy, for answering those as we've been going. I would like to go over those, so everyone who's not been monitoring the chat box gets those answers as well. And the first question was whether or not the H54 carry forward will be reported in this PIMS report. And yes, any activities in this report in this past year funded through H54, no cost extension will be labeled as carryover. Another question was, should this list be all critical access hospitals in the state or just participating cause? And the answer to that, go ahead.
Caleb?
Yes.
This is Jill. Can I
Hey,
ask
Jill.
a question about the carry forward?
Yeah.
So you take those dollars and those activities are then reported the same way as the other ones are?
Yes, so you're gonna just kind of combine those two work plans. So whatever work plan you had for the H54 no cost extension with your FY 2019 work plan, so that we're capturing both the funds and the activities.
Okay, thank you.
And then, excuse me, the other question about the carryover was that, or about the participating critical access hospitals, was that you will only be recording data for the participating hospitals in PIMS. So those are the cause you want to make sure are included. And as we saw in the screenshot there is an opportunity. You'll have a list of your hospitals and you just check a box whether or not they participated or not.
Correct, and historically it has been critical access hospitals that have been participating in the Flex program. But if you are seeing any errors, that's certainly something that you should address with your project officer immediately so that we can change either the hospital name, you know, the CMS number, or the location.
The next question was if your state has added a hospital and now it would be available for reporting in FY20, but the hospital in there, okay, hold on. Reporting in FY20, but the CA in there, so can identify them for participating in Flex activities.
Hey, Caleb.
Yeah, go ahead.
Yeah, let me explain. We had a brand new CA that came in just last month in August. They did not participate in any of the FY19 activities. So my question was, do we add them now for the FY19 report, even though they didn't participate in any activities, just so they're there for FY20, or do we just wait to put them on the list until FY20?
Hi, Jen. I can put them in now, but you obviously will not be reporting for them for the FY19 year.
Thank you.
Yeah, and that would be my thought, was that they would be on the list, but they just wouldn't have their box checked for participating.
Exactly. Thank you, Jen.
Another question about whether or not EMS supplements will be submitted in this PIMS report.
And my response to that is no, we should not be reporting on EMS supplements as in previous years. That will be through a separate end of year report specific to the EMS supplements.
I think those are all the questions I have in the chat box. Again, I do encourage anyone to unmute their microphones and ask questions there. Oh, here, another question came into the chat box. Should we report on activities that are only partially complete for FY19 that were delayed due to COVID? If there are any known improvements, or we should wait until next year once that's completed to report those? That's a good question.
That's a great question, Stacy. I would encourage you to follow the money on this. So if you plan to have those activities as a carryover request going into next year of the reporting period, then hold off on reporting at this time and then include it as, the carryover request for next year's PIMS reports and activities completed for next year. However, if you've already partially spent out those dollars and you plan to report that in the FY19 spending, then I encourage you to report those activities in the 19 spending.
And I think that question, that's a good question for regular activities that were not delayed or impacted by coronavirus or the COVID pandemic. There will be and ought to be many efforts that you guys have that do cross, Monday to today, that you'll want to mention and discuss what's going on and who's participating and whether or not you have any outcomes, regardless of whether or not that activity is completed and you have all of your outcomes. Got another question. So yes, we will not be submitting the EMS supplement reports in this PIMS report. All right, so I'm going to share my screen to go over the PIMS data collection tool. So for those of you who have not been, those of you who have not had an opportunity to see this, if you're new to the Flex world or the PIMS data collection tool, we here at TASC developed this tool a few years ago, and it's been through a few iterations. There's an update history on the bottom left there. So this is the 4th iteration. And hopefully this incorporates all of your activity categories. So there's expansion for the rural innovation models, as well as separating out population health and emergency EMS service activities. So those are the big new changes for those of you who know or are familiar with the PIMS data collection tool. Excuse me. But really the purpose of this tool is something that you guys can hopefully utilize during the year and track your activities moving forward. So you're able to copy and paste a list of your critical access hospitals with their CMS number, facility name and city, and then it should be easy enough to identify whether or not that hospital is participating in the activities listed under each area. So everything is color coded. So from instructions over here, quality improvement, operations, operations and financial, population health, EMS, innovation, conversion, and then there's a financial spending report at the end of this that connects to what Tori was talking about of following the money. That way you're able to see where dollars were spent per activity. So when you go into the the operations and finance section, your list of hospitals will be here. We tried to make more spaces for your hospitals than you should need. We have 100 spaces there, and I think Texas is the most with fewer than 100 critical access hospitals still. So you should be able to copy and paste your hospital's names in there and then just track whether or not they participated in the activity, what their baseline data indicated, and then what that improvement was, what the improvement was afterwards, and on you go. So each section should have the activity area, so 3.1 supporting hospitals identifying community and resource needs, building strategies to prioritize and address unmet needs in the community, and so on and so forth. So each one of these areas should have at least a template for you guys to track whether or not your hospitals are participating. And when we get to the hospital conversion and the financial spending report, those are where the little bits of changes happen. And part of that is because some of the designation for the critical access hospitals, they won't be critical access hospitals yet. So requesting critical access hospital designation successfully converted, or whether they're still in the midst of conversion. I know converting to a critical access hospital can take a little bit of time. There's also an opportunity here to track those who are converting from critical access hospital to something else, which is something that you guys need to be aware of and track as well. The financial spending report is a tool really to help track those dollars and where it is. So activity 1.5 on the quality improvement area. So it's required, and it's report and improve additional patient safety measures. So if that is something the hospitals are participating in, you can separate out that direct spending or the percentage of your grant or cooperative agreement that gets allocated to that activity. And then when you break that out for your 15 of the 20 hospitals who are participating in that activity, you can break that down to a percentage, and then the total flex spending, and so on. And each one of these has a subtotal here that gets calculated from that, and then on down we go. So this bottom total flex budget allocation should be the summation of all of those spending amounts. So it should hopefully help you complete this, so you're not having to go into EHB, find what you need, and then, or find out what you need, and then go off into the world and find it. It hopefully should be here for you once you have the data collection tool completed. You bring that with you to EHB to submit your PIMS, and it should be a relatively painless process. There are opportunities for mistakes on our part, or things that we left out of the tool. So as you guys wander around this tool, please do let us know if you see opportunities for improvement, number one, and things that we've messed up. If we somehow messed up our, not calculations, but our formulas in our Excel document here, such that they don't total correctly, please let us know, so we're not making all 45 flex coordinators fix our document. We can fix it once for each of you guys. So the instructions go have some pretty detailed definitions on what improvement means, what participation means, where those data sources are that you might be able to procure this information, what resources you can look for to help with these. This webinar now will replace the recording of the walkthrough tool here, as well as we are currently working on filling out one of these with mock data, just as an example. We had that in the past, and we just need to get those data points into the updated tool. What questions do we have about the data collection tool? I see the chat box is going. Thank you, Andy. Andy just posted a link to the data collection tool, which is available for download on the website currently. Yeah, thanks, Jen. Hopefully it is helpful when you're putting your PIMS data together and not an added burden. We tried to make it relatively simple and not a ton of stuff. And I did note that there's some discussion about the color coding, and yeah, hopefully it gets a little easier when you start putting data in there for the separation. And that's the purpose of it, is to separate hospital from hospital, so you're able to see the difference in the lines. But I don't believe this tool is locked, besides the financial spending report on the last one, just to maintain the integrity of your formulas. But download the tool, make it yours. We can send you an unlocked version if these are locked. I don't believe the first areas are. So if you need to change it for your own ease of visualizing it, that's totally acceptable. All right.
Are you going to make the slides available on TASC website?
Yes. Yeah, they will be in that PIMS resource page. If they're not already, they will be shortly. Yeah, there's a bunch of really beneficial information in those slides, and some instruction sheets and things that will be available as well.
Yep, one of the PDFs that will be available as you're completing PIMS is a complete mock-up of the PIMS forms. So you can actually go and see what each of the forms looks like before you get in there to actually submit your data. There are some drawbacks with the EHB system. For example, it will time you out. So please make sure you're saving your information frequently.
Yeah, that's a good point. And those of you who have not wandered around EHB or submitted your PIMS reports before, I do encourage you to do so. When you go in there, wander around, find out what it looks like, see what it feels like for you, and then come back and start submitting your data. You can, correct me if I'm wrong, Tori, it's been a little while since I've saved my data in there, but you can enter some data, save it, and then come back and then complete it and submit each form as you go.
Yes, you can save each form and then go out of the system and then come back in. That's definitely possible. And you can go in and edit until you validate your data, which creates that PDF form of all of your data submissions. And then you have to click submit to your project officer. And at that point, it gets sent away.
That way you don't have to do everything from financial and operations to innovative models all in one. You can do step by step, save it, come back to it. Identify questions that you have, find more data, things like that.
Yeah, and Stacy just had a question about reporting data on input outcomes from the work plan that will be incorporated into the end of year report. And yes, that's correct, Stacy. I'll be looking for your completed year one work plan with those that actual output measure column filled out when you submit your end of year report. And Scott mentioned that there seems to be issues with PIMS loading. I just spoke with our developers not an hour and a half ago, and they reassured me that those problems had been solved, but I'm not convinced. So if you are having trouble, please let me know immediately, and I can try and escalate it as soon as possible to work on a workaround. And thank you for bringing that up, Scott.
Hey, Caleb.
Yes, Catherine.
Great, you can hear me. I just wanted to give a shout out to the new or newer Flex coordinators if this is your first year doing PIMS, because I realize there are some new faces this year. I just wanted to say, after being here a while, the first year or maybe even two of PIMS can be overwhelming, and you might be thinking, you know, after looking at this that, oh my gosh, I got to gather all this data and it's overwhelming. And while it does get better. And they have put together some really good resources, and the FAQs I found often answered my questions before I had to go to my program officer and ask the question. So, and of course they're there for questions, and so that's very helpful too. But it does get better because you'll be doing this every year unless there's, you know, dramatic changes to it. But once you get in a rhythm, and I just keep a folder each year of how I gathered the data, and that helps remind me for the next year. So just wanted to say that it might seem overwhelming, but it does get better.
Yeah, thank you, Catherine. Yeah, and that's a good point. The more you do it, the more familiar you are and become with it. But as you guys identify opportunities to improve the data collection tool, the instruction sheets, whatever the case may be, please let us know, as well as we discussed, if there are issues with EHB, please let your project officer know so they can get that escalated as quickly as possible and get that fixed for you guys. It shouldn't be too painful. It's really saying, hey, which ones of your hospitals participated in your activities? You know which activities they're doing and whether or not they improve. And I try to just simplify it to those, you know, really just quick and easy questions. And once you have that, then it's really easy, as Catherine said, to go find out, find the answers to those questions, who participated and whether or not they improved. And I think that helps. Thinking about it that way also helps with your activities of, all right, well, what is our outcome that we're hoping for? Did they improve? Are we trying to reduce days in A&R, days in accounts receivable? If that was our effort, did our hospitals reduce their days in accounts receivable? And if they did, awesome. If they didn't, then that's an opportunity for us in our project, in our Flex program, to work with our contractors or whomever within our house to say, hey, we had a lot of participation and effort put into this, and it didn't quite have the intended or expected outcomes. Now we can do some process improvement on our end as well. So it's just another opportunity to check in, see how things are going with your efforts, and then improve or continue, or hey, this one was much better than we thought it would be, or much more participation than we thought it would be. People really seem to gravitate toward that, so we can utilize that activity in other areas for other opportunities.
So I did just receive real time an email from our developers. So if you are having a functional issue, like you're having issues inputting data into the system, please feel free to reach out to me immediately. Our developers are willing to do a 30-minute kind of open office hours once a week to answer any functional questions and walk through that problem with you. If you're having any IT issues, like PIMS just isn't loading, or you can't have access to the system itself, I encourage you to submit an EHB help ticket and then let me know immediately so that I can escalate it on my end as well.
So what other questions do we have? And then we can let Tori discuss the end of year report, and then we can have the exit polling questions up here in a little while as well. But I want to make sure Tori gets to talk about the end of year report, which the instruction sheet we're working on currently as well. All right, well, hearing no questions, I'll ask Andy to put those polling questions up, but don't leave the webinar yet, because Tori has some information about the end of year report. All right, we'll let the let the rest of you guys complete these polling questions. So in regards to my familiarity with the performance improvement measurement system, reporting requirements and process, I am very familiar, neutral, unfamiliar, and very unfamiliar. And the second one is in regards to my comfort level of data collection. I am very comfortable, neutral, uncomfortable, and very uncomfortable. All right, guys. So Tori, take it away.
Great. So I did share this on a slide, but I did want to just kind of give you a preview of what the end of your report is going to look like. So again, this is going to be for year 1 of the Flex program, detailing activities that occurred from September 1st, 2019 to August 31st, 2020. So I'm going to be asking you to detail one significant accomplishment or activity for each of the Flex program areas in which you worked in year 1. That can also include, any H54 activities that you were wrapping up. And then you are going to submit a completed work plan with particularly this column filled out, the actual outputs column that is blank on your work plan currently. This is also an opportunity if you had any changes in your year 1 work plan to update that information for this submission. So I wanted to keep it fairly short and sweet with just detailing the significant accomplishment, describing the activity, what the impact of this activity was, what lessons learned and best practices were included, and importantly, recommendations if you would recommend doing this activity for another Flex program. Tracy and I were talking just today about if we could kind of translate this important information into your state Flex profiles. So I will be including a bit of language in here asking your permission if TASC would be able to share all or some depending on what permissions you give, of this information to include on your state Flex profile. And that would be a part of your update that you do annually for those. The only major change that will happen with the 6 program areas is this COD designation piece, because it doesn't really make sense to include the wider array of information for that. So we're just asking for lessons learned and best practices if you have any for the COD designation section of the program. This information will be available to you, I am hoping, by early next week, and it will also be a task that will show up in EHB for you to submit by November 30th. And I also welcome any questions that you have on the end of your report.
So please do let us know what questions you have. The chat box is open there. Please do unmute your microphone if you have any questions. As Tori said, we're just about finished with this, so it should be able to get posted to the website and sent out to you guys in the next couple days. And there's always an opportunity then to let us know what questions you have or issues that you guys identify with the instruction sheet, which, as Tori said, kind of acts as a template for you. All right, well, hearing no questions, I will encourage you guys to take a look at the data collection tool. Let us know if you have any questions or issues that come up while you're familiarizing yourself with the data collection tool, as well as EHB and collecting some of that data. As with all of the resources that we create here at TASC for you guys, we create them for you. So if while using it, you guys identify opportunities to make it better, to improve it, or something is just not working, and even if you don't have an improved suggested improvement, please let us know, and we're happy to make it better and make it something that's useful and beneficial for you guys. At the end of the day, that's what these tools are for. So please do let us know if you have not well, yes, complaints, but anything that you'd like improved in either the data collection tool, the instruction sheet, or if you just have questions, please don't hesitate to reach out at task@ruralcenter.org or your project officer. Really, there's no wrong door when you guys have questions. All right, thank you, Carl. Getting some applause. Any other questions, comments? Hey, Trish.
Hey Trish, did you see that notice of award come through?
All right, guys. Well, as threatened, we got done with the webinar a little early. So if you guys do have any questions come up, please do let us know. Otherwise, I'll encourage you to have the rest of the nice week. And I believe there's a holiday on Monday, so have a nice long weekend and enjoy yourselves. Good to see you guys. And yeah, please do let us know what we can do to help. Thanks, guys. Thanks, Tori. Thanks, Christy, for helping answer all those questions.
Thank you, Christy.
Great. See you guys.